With that, I'm very excited to announce that Sarah Angelo is our 2025 National
Sarah deserves to be the National Administrator Champion because she is the one person who would never expect it. She puts in all of the work and all of the time and would never expect the recognition.
I've worked home health for many years and I've had some great bosses, but sometimes I feel like Sarah would never ask me to do something that she wouldn't do herself.
Sad to say, I'm mostly in the office now, but I do make visits. If we need extra nurses, I am more than happy to get out of the office and do that. Also, I have some favorite patients that I've had on several times. Hello! If we can be there to not only provide them the services they need. Do you mind if I check your blood pressure?
Oh, yeah.
Okay, great. But also provide them with a friendly face.
Well, it's hard to make it a doctor's appointment and find somebody to take you. Having somebody walk through the door and said, "We're here," is great.
How's your leg pain, Dawn? I like the connection that you get to make with people. I like going into their homes.
I've got an appointment coming up.
I like getting to see their environment and what their goals and their challenges are.
We really appreciate Sarah, we do. She's been very helpful and encouraging.
I'll make sure Amanda keeps checking on you, Dawn. We'll see you next time.
We serve quite a large area here in the Black Hills. She allows the opportunity to see those patients and then covers for whatever is needed at the office while we're out seeing patients.
She makes you excited to come to work. She's a great troubleshooter, so if you run into problems, you're never afraid to go to her and ask for questions and have her help you through it.
She'll stop whatever she's doing to help get you on your path and get you back out doing your job.
She's a great leader because she's always stepping in those steps right beside you.
And then when we get a referral and it's a challenging patient.
So my dad, when Sarah met him, was 82, lived alone.
They have a challenging situation.
Third floor apartment with no elevator.
Or they're just a difficult patient to work with.
He was stubborn.
Those are the patients that I like. Hello.
Welcome.
How are you?
I'm good. Hey, come
Nice
on
to
in.
see
It's
you.
so nice
Yeah.
to see you. Oh my God.
She connected with him immediately. Thought you might find these interesting because I think every once in a while he maybe talked about his job.
Kind of formed an unlikely bond.
He said, you know, that's Sarah. She's a good one. For him to say that about anybody was very rare.
Sometimes people put up a wall or push people away, but once you get past that, there's some really good stuff.
There came a time he really became pretty weak and fell. The physician said, you know, here's all the things that are going on with your dad. We just recommend hospice. We found a bed for him at Good Samaritan, St. Martin's Village. At that moment, it was like, okay, I can have this conversation with Dad because Sarah works for Good Samaritan. And even though she's in home health and he was going to hospice, and I said, you know, they have a spot for you at Good Samaritan and Sarah's gonna be there and she'll be able to check on you. And he said, okay. And that was the last thing he ever said out loud. He knew he was going, but he also knew that Sarah was gonna be there and that made it okay.